Hi, I'm Dr. Eric Balcavage. I want to thank you for requesting this DVD on fibromyalgia. If you requested this DVD, either you or a family member or friend is suffering with fibromyalgia. I want to let you know that myself and a team of doctors around the country are successfully treating fibromyalgia and getting amazing results. If you've been suffering for a long period of time, I know how you feel. It's a debilitating thing. You're suffering with all kinds of challenges and problems, and it's limiting your life. You've requested this DVD because you want to change that, and the things you've done to this point haven't been successful. You may have been to 1 or maybe even 10 doctors to this point with limited and no success, and it becomes frustrating. At some point, everybody just starts to tell you it's in your head and you're nuts and you're crazy. Well, you're not. Fibromyalgia is a real disorder, and we have some real solutions for you. One of the biggest problems with it is people think that fibromyalgia is a muscle disorder, and it's not. What we know is a neurological and chemical disorder, and unless you do the right testing, you'll never find that out. The good news is these are the types of testing that we're doing to evaluate your condition and to be able to give you a solution for getting rid of your condition. So I want to let you know what makes us different. For us, our goal is not to treat your condition, not to treat your fibromyalgia, not to treat your symptoms, but actually identify the underlying cause of what's creating the problem and then work to find a solution for and correction for those problems. What I'd like to do now is give you a very simple explanation of how the body works so you understand what makes what we're doing different than what you've experienced in your medical care so far. So, first of all, I'm going to draw a picture. This is your brain. Your brain communicates with your body through what's called your nervous system. And your nervous system is just a flow of electrons and communication. It's an electrochemical system that allows for messages to go from the body to the brain and back down to the body again. And when this system runs uninterrupted without stress and irritation on it, then we say the body's in a state of optimal function. "100% function." That's how it's designed to work. That's how it should work. Unfortunately, it doesn't always work that way. But when we have 100% function, then we say that the body's in a state of ease or balance or harmony. That's the way the big guy intended it. However, we tend to get stress or irritation to the nervous system. So when there's irritation or stress on the nervous system, it starts to alter the communication, the messages that go from brain to body. If you remember back to some of the Verizon commercials where they would get some communication in, instead of bringing home the car, they bring home a soap opera star, you kind of get that idea. The game of Whisper Down the Lane where the message gets changed. Anytime there's irritation to this nervous system, the messages get distorted and changed, and it alters function in the body. So we no longer have optimal function, but we start to have malfunction in the body. That 100% becomes something less than that. Malfunction over time leads to a state of dis-ease, lack of balance, lack of harmony in the body. And this is when the body starts to break down or continues to break down. And over time we start to develop these. And symptoms are what we typically start to use to recognize that, hey, I'm not doing so well or I'm not feeling well. 7 of the most common symptoms that there's stress or irritation on your nervous system are things like headaches or migraines, sleeping problems, irritability or mood swings, sinus and allergy problems, fatigue, digestive problems, and pain. So these are the 7 most common symptoms that there's stress or irritation on your body, and these are most often some of the most common symptoms that people with fibromyalgia suffer from. The difference on how things are treated, though, really occurs here. In a medical world, and this is probably why you haven't had success to this point, if you go to your doctor and you have pain, he's going to give you something to treat the pain. But if you just got to take something to block the pain, you haven't changed what's happening with this dis-ease process or this malfunction that's occurring in the body, or you haven't done anything to remove what's irritating the body. All you've done is temporarily remove the symptom. When you stop taking the medication, the symptom comes back. Or over time your body compensates for it and that medication may not work anymore. But what you start to see is, hey, now I get another symptom, and another symptom, and another symptom, and another symptom. So the doctor is really focused at trying just to get rid of these things, and that's where medication can work, at least for a short period of time. The other thing we're really good at in the medical community is saying, hey, you've got these 4 symptoms. Well, those 4 symptoms typically go with a diagnosis. And once we diagnose you, now we know we're going to say you are a fibromyalgia sufferer, And unfortunately, everybody gets treated with the same way. They get the same drugs, the same medication, and the same treatment. Unfortunately, what's causing everybody's body to break down, to malfunction, may be different causes. Different things may be creating this irritation which causing their body to break down. The biggest thing that we find in my world is that we're looking for what the cause of this irritation is. And what we found is the biggest thing that causes the body to break down is stress. And stress comes in three forms: physical stress, chemical stress, and third is emotional stress. And it's these stressors that create the stress and irritation on the nervous system that starts to alter the communications, what causes the body to break down and creates the disease. The reason you haven't had success at this point is because your doctor's been focused on treating this. When in reality, we need to find out what these stressors are that are causing the problem. And for most people, most patients with fibromyalgia, it's not one of these issues, but usually multiple problems. It's physical, it's chemical, and it is emotional. And all three of those things have to be addressed if you're going to get correction. So I want to explain to you a little bit different about what we do and the testing we do to evaluate these different things. So now that we've explained how the body works, what we want to do is explain how our testing is going to be a little different, what we're going to do to evaluate those three types of stress: physical stress, chemical stress, and emotional stress. First of all, we'll talk about physical stress. What is physical stress? Physical stress is falls, accidents, injuries, bad posture, sustained positions, sustained activities that you do over and over and over that can create problems in your muscular system and your skeletal system. We want to evaluate those things, and we're going to evaluate them from the ground up. Because something as simple as your arches dropping can set a cascade of joint problems that can start to create pain and problems in the nervous system and even in your chemistry system. So we'll evaluate those things: proper chiropractic assessment, postural assessment, flexibility, range of motion testing. All those things need to be evaluated first. Second, we're going to evaluate your chemistry. So we'll give you some things called a metabolic assessment form, which you will receive in a package, neurotransmitter assessment form. And these things are going to ask you questions about your daily activities and the things that you experience from an organic standpoint: how your digestion is, your sleep habits, how you relate to blood sugar issues. And we're going to ask you what kind of foods you eat and what things you do eat and you don't eat, and some of the other chemistry issues that go on in your day. We're also going to want to do some pretty extensive lab testing. And I know you've had lab testing done before and everything's been normal. But the problem with lab testing that most people get done is they use what are called lab ranges to determine health. Lab ranges are pretty wide ranges that you see on your lab reports. And if you didn't know, lab ranges aren't real scientific ranges. They're based on keeping 85 to 90% of the people underneath the bell curve. When we get tests done, most of the people that are getting those tests done are people who are sick and on drugs and on medication. So those ranges over the years have gotten wider and wider and wider. The problem with is that what we find is a lot of people with fibromyalgia they're underneath that curve. They're within the lab ranges, and yet the doctors say you're normal, when in reality you're not really normal. We use a different level, and it's called a functional level, a functional blood chemistry level, which is based on really healthy individuals. So since our goal is to get you healthy and not just have you not sick, we want to use functional lab levels to evaluate. So we're going to do a comprehensive metabolic panel, and it's some of the chemistries that you've already had done, but we're going to take a tighter look at it. And we're not necessarily going to look for one number that's high or low, but for patterns of problems. Using those blood chemistry levels and comparing them to your assessment forms, we'll be able to get a pretty good idea of what's going on. The other thing we're going to do is we're going to want to do a thyroid panel, because thyroid conditions and thyroid problems are often associated and often seen with people who have fibromyalgia. So we will want to do a comprehensive thyroid panel. And I know you may have had thyroid testing done, but typically what I see is that people have had the TSH level done and maybe a T4 or T3 level, but really what you need is a comprehensive panel done. There's about 22 patterns, if not more, of thyroid problems. In the US, we treat all those problems with in a medical model, with one type of treatment. That's to give you Synthroid or some other type of medication to lower your thyroid levels. The other thing we want to do in that thyroid panel is we want to run what's called thyroid antibodies, because 50% or greater of the people who have hypothyroidism actually have an autoimmune disorder called Hashimoto's syndrome. And the only way to know that is to run thyroid antibodies, which typically aren't done. Besides the thyroid panel and the complete lab panel, we're going to want to do your lipid panels, your cholesterol levels, HDL, LDL, and triglycerides. These are going to give us an idea if you're suffering with, not that you have high cholesterol levels, but if you're having blood sugar problems, if you're having reactive hypoglycemia, or you're insulin resistant or already into a diabetic state. Because your brain needs good fuel delivery to be healthy. Those two fuel sources are properly regulated oxygen and properly regulated glucose. And looking at cholesterol levels is a great way to tell if you're insulin resistant and not managing your blood sugar properly. So we'll want to get those things done. The next thing we'll want to do is do what's called a complete CBC and differential. So this is looking at your white cells and your blood cells. We want to look at these for two reasons. One, we want to see if there's an underlying anemic pattern, which could be affecting how your brain and your chemistry is working. Because as I said, your brain needs oxygen as a major source of fuel. If you're anemic, you can't get fuel to your brain. And since your brain, and especially your cerebellum, the back part of your brain, is the most oxygen dependent part of your body, anemic state, whether it's lab anemic or just developing anemia, is going to affect your fuel source and affect how your brain functions and affect how your neurology functions. Also, we want to look at your white blood cells. And we want to see if there's an underlying infection that's creating your inflammatory problem, that's creating your pain. So in typical lab ranges, they're really typically only looking for a white count above the lab range as an infection. In functional endocrinology, what we're really looking at is if you're not within the functional range, too high typically means an acute infection, and a white blood count lower than functional range typically means a chronic infection. And so we want to look at those ranges and then look at the differential, how the blood cells are differentiated, so we know what type of an infection is there, if it's there. Is it bacterial, or is it viral, or is it parasitic? So we'll do that. The next thing we want to do is some testing of your cortisol levels, because so many people with fibromyalgia have sleep issues at night. They have a hard time staying asleep or falling asleep, and they'll find themselves during the day exhausted and tired, especially around 2 or 3 o'clock in the afternoon. What we do know is that there's a little part of the brainstem called your Melanin Cephalon, which controls sleep and wake cycles. People who suffer with fibromyalgia typically have that Melanin Cephalon misfiring. And so what they'll experience is about 2 or 3 o'clock in the morning, they'll wake up for no apparent reason. They may think they have to go to the bathroom, they may wake up because they say they're in pain. And then 2 or 3 o'clock in the afternoon, when their brain should be most alert and awake, they're exhausted because that Melanin Cephalon isn't firing properly. One of the things that affects that is cortisol levels. And so I know some of you have probably already had a blood test done for cortisol, but we don't use a blood test. We use a test called an adrenal stress index, which is a salivary test. Cortisol levels should fluctuate from highest point in the early part of the morning, drop as the day goes on, and then increase slightly into the evening. And so if you do a blood test and you take it once per day, you don't know if you're regulating your cortisol well. So we want to check it 3 or 4 times during the day so we can determine if cortisol functions properly. If you didn't know, cortisol is toxic to the brain. So people who have fibromyalgia who complain of fibrofog and can't think clearly, cortisol is usually the culprit that's creating that problem. So we want to test for that. We also want to look to see if you have an autoimmune disorder. Because if you have an autoimmune disorder, we have to address it. That kind of trumps everything. And nobody that I've seen so far has had autoimmune testing done prior to coming in. And so what we're looking at is what's called T and B cell lymphocyte studies and natural killer cell studies, so that we can evaluate the immune system. There's 2 sides to it, what's called Th1 and Th2. We want to make sure those things are in balance. Now they typically are like a teeter-totter. They may sway up and down, but if one side is really firing high and the other side is firing really low, that's an imbalance. And we don't want to see that imbalance. And so what we have to do is work to modulate it. This is one of the tests that I'm often told from primary care physicians that when we ask to get this done, they say they won't do it because it's not medically necessary. Let me give you a little information about how medical necessity is sometimes determined. These tests are sometimes determined not to be medically necessary because A, the physician doesn't know what to do with the results once they get them, and B, there's no medication at the other end. So if there's no medication to treat you with at the other end, is the test really necessary? We find it is, because what we do with those findings is we have to modulate your lifestyle. Your lifestyle has created the problem you have, so now based on what we find from your immune panels, we know what you can eat, what you can't eat, what supplements you can take or you can't take, and even the things you may be taking right now that you think are beneficial for you to make you better, like garlic or echinacea, could actually be making you worse. The next test we want to do is we're going to test for H. pylori. H. pylori is a little bug that gets into your stomach and can create some problems with digestion. So we want to look for that. Some people have gotten blood tests done for this, or maybe have had even a biopsy done, but we find that one of the easiest tests to get this done is called a urea breath test. Relatively inexpensive and is a pretty definitive test. Next, we'll want to check for intestinal permeability. And what this means is that the lining of your intestinal tract isn't functioning the way it's designed to. So food, undigested food, is either leaking out of the gut, or there's a slime layer covering that intestines that's not allowing for nutrients to get dispersed out into the bloodstream. Both of these conditions are bad, but we need to check for it. We're going to evaluate your neurotransmitters, because what neurotransmitters are the chemicals that help the neurons fire and communicate with each other. If they're out of balance, the nervous system can't communicate properly, so we have to evaluate for those. We may do hormone panels, female or male hormone panels, because a lot of times once the chemistry of the body gets disrupted, your hormones become imbalanced. Women may start to see hairy growth where they shouldn't, and men may start to see changes in their body that they don't like seeing. We're also going to do some tests for inflammatory markers like C-reactive protein and homocysteine levels. These are classic markers for whether you have an inflammatory problem. And while they may not tell us what the inflammatory process is, they'll definitely tell us if it's an inflammatory process, which we often find with fibromyalgia sufferers, that's causing your problem. Once all these tests are done and completed, we can put those together, combine those with the neurologic testing that we do, and the structural testing we do, and stress surveys that you'll fill out to evaluate your emotional state, and we can sit down then and formulate, hey, here's what's wrong, and here's a treatment program to get you better. In our office, the treatment may be different. Well, I can guarantee it's going to be different than what you may have experienced in the past. And it's going to be a combination of things, most likely. If there's a structural problem, we're going to address those structural issues, and we're going to address it with some specific type of chiropractic adjustments, maybe some what's called decompression therapy if there's an underlying joint dysfunction that's creating some problems. We've got to work on stretches and exercises to build up a supportive network to maintain better posture. If there's neurologic imbalances that we assessed on our test, we want to rebuild those parts of the neurology that aren't firing well. Your brain is like a big muscle, so if it's fatigued and weakened, we want to build it up to strengthen it. And that can all be done with brain-based exercises. And the therapy we use is called brain-based therapy. Once we evaluate what needs to be done, the exercises are fairly simple to perform, and a lot of these things can be done at home once you have a good handle on how to do them. We'll also look at that chemistry component. So based on the chemistry and what we find from those lab tests, we're going to tell you, hey, you have to make some significant lifestyle changes. You got to modify your diet. You got to modify what you're eating, what you're drinking, and we may recommend a supplementation routine. And I don't want you on supplements for the rest of your life. How we typically do things is we do every 60 days. If we have you on a supplemental routine, we're going to retest those tests that were positive, and we should see a change within 60 days. Then we can modify and keep making changes to your nutritional protocol until we've pretty much cleaned